All right, welcome to The Explainer. We're going to tackle a topic today that is, and I mean this, absolutely crucial for every single massage therapist out there. We're talking about how your client's medications can totally change the game for your treatment and for their safety. So picture this. Your next client walks in, and on their intake form, you see blood thinners, beta blockers, and antidepressants. Are you ready? Because this isn't some textbook hypothetical, right? This is your Tuesday afternoon. And knowing what to do next, well, that's what makes you a safe professional therapist, not just a good one. Okay, so first up, your client on medication. And let's be real, the vast majority of our clients are taking something. It could be a prescription, sure, but it could also be over-the-counter stuff, vitamins, herbal supplements, you name it. And every single one of those can have an effect on the body we're working on. And that's why this is so important. Your awareness of what they're taking isn't just about ticking a box on an intake form. It is, without a doubt, your #1 tool for keeping that client safe and making sure your treatment is actually effective. It's a huge part of being a professional. So how does this all work? How can massage actually mess with medication? To get it, we need to talk about what I call the drug's two-way street. It's based on two big ideas from pharmacology. But don't worry, we're going to make it super simple. Okay, here they are. Pharmacokinetics and pharmacodynamics. Sounds complicated, but it's not. Just think of it like this. Pharmacokinetics is what the body does to the drug. It's the journey, right? How the body absorbs it, moves it around, and gets rid of it. Pharmacodynamics, on the other hand, is what the drug does to the body. That's the action, the effect it has once it gets where it's going. Journey versus destination. Simple as that. This diagram here lays it all out perfectly. You see the journey, that's the pharmacokinetics, and then you see the action, the pharmacodynamics. Now here's the kicker for us as therapists. Our work, our massage, can directly impact the journey. We can change how that drug moves through the body. And if you change the journey, you can accidentally change the final effect. That is the connection we have to get. So let's break down that journey, the pharmacokinetics part. It's a 4-step process. First, absorption. The drug gets into the bloodstream. Think of this as the package getting picked up. Second, distribution. It travels around to the tissues. That's the truck on the road. Third, metabolism. The body breaks it down. The package is opened and used. And finally, excretion. The body gets rid of what's left. The packaging is thrown out. If we interfere with any of those steps, especially the first two, we can change how strong the drug is or how long it lasts. Okay, so how does massage actually change things? Where do we fit into this whole equation? How can your hands-on work actually alter this carefully balanced process? Well, it's pretty simple, actually. Massage has a massive impact on a drug's distribution and absorption. Why? Because we are directly changing circulation and nervous system activity. The big one is blood flow. When you get that circulation going, you're essentially speeding up the delivery truck. That drug could get where it's going faster, or it could be flushed out of the system quicker than it's supposed to be. And it's not just massage in general, your specific strokes matter a lot. Look at this breakdown. A nice, long effleurage stroke, you're boosting circulation, which can speed up that drug distribution. You do some deep petrissage, that kneading, you might be increasing how fast a drug is absorbed from the muscle. And tapotonement, all that percussion stuff, that stimulates the nervous system, which can totally alter how the body responds to CNS meds. See? Everything you do has a potential downstream effect. All right. Theory time is over. Let's get practical. How does this look on the table? We're going to dive into some red flags and the modifications you need to be making for some of the most common medications you're going to see. And there's no better place to start than with blood thinners. Listen to this quote from Dr. Brent Bauer at the Mayo Clinic. He's talking about anticoagulants like warfarin and says they make clients more prone to bruising and internal bleeding. This is a huge flashing red light. Deep work on these clients isn't just a bad idea, it can be dangerous. So let's talk about cardiovascular disease. Your client might be on anticoagulants, beta blockers, you name it. Your job here has two parts. First, the big one, avoid deep tissue work, no question. The risk of bruising or worse is just too high. Second, be super mindful of their blood pressure. They might get dizzy when they get up. That's called orthostatic hypotension. You need to be there helping them sit up slowly and safely. Next up, arthritis. A lot of these clients are on NSAIDs, like ibuprofen or even corticosteroids. Here's the trap. Their pain perception is altered. They literally can't feel if you're going too deep. So when they say more pressure, you have to be the professional in the room and say no. Long-term steroid use can also make their skin and tissues really fragile. The rule here? Gentle strokes only. Avoid deep work, friction, and definitely stay away from any injection sites. Now, diabetes. This one is all about planning and being prepared. Massage can actually lower a person's blood sugar, so you need to be smart about it. Ask them if they've eaten. Try to schedule their appointments when their medication is at its peak, not when it's wearing off. And this is non-negotiable. You must have a sugar source on hand, like juice or a glucose tab. You have to be ready for a potential hypoglycemic event. It's a small thing that can make a world of difference. Okay, this category is a big one. Pain and mental health meds. We're talking narcotic painkillers, muscle relaxants, antidepressants. The common thread here? Altered perception. Their feedback is unreliable. They can't feel pain or stretch the way they normally would. This means the risk of you over-treating them and causing an injury is through the roof. The responsibility is 100% on you. Again, avoid deep tissue work, be super careful with stretching, and always help them off the table. Okay, that's a lot of what-ifs and red flags, I know. So with all of this to keep in mind, what's the one thing, the golden rule, that will keep your clients safe every single time? It all comes down to this, a thorough and ongoing client intake. And I can't stress ongoing enough. This is not a form they fill out once and you file it away forever. It's a living document. It's a conversation you have at the start of every single appointment. And you need to ask the right questions, not just, are you on any meds? Go deeper. Ask about everything. Over-the-counter stuff, vitamins, all of it. Ask why they're taking it. That gives you the context. Ask what time of day they take it. That helps you schedule safely. Ask if they experience side effects like dizziness or bruising. And crucially, always ask, has anything changed since I last saw you? Because at the end of the day, it's this simple. The safest massage is the most informed massage. Your knowledge is what protects your client. When you understand this stuff, when you commit to that ongoing conversation, you're not just giving a good massage, you're providing true professional health care. So I'll leave you with this to think about. Are you truly informed before your hands ever touch your client, every single time?